Hello, my good people. The weekend is approaching, and I hope everybody is fine. Before we get to our point of discussion, I can't forget to appreciate you people for the continued support you are showing this channel, and I hope all what we are discussing is helping you guys. I know it will help you yourself, your sister, your brother, and your relative. So let's get back to our topic of discussion, whereby we are discussing about fibroids. And in this point, in this video, we are going to discuss about the second type of fibroid. The first type of fibroid we discussed about intramural fibroid. And the second one we are going to discuss in this video is what we call subserosal fibroid. As we said during our introduction, the name depends on where the fibroid is situated. So, what is subserosal fibroid? Subserosal fibroid forms outside of your uterus. Outside of your uterus, which is called the serosa. It may grow large enough, making your womb grow bigger on one side. Subserosal fibroid forms outside your uterus in a place or in a specific place called the serosa, and may grow large enough, making your womb grow bigger on one side. So, subserosal fibroid projects outside the uterus and it's non-cancerous. Some subserosal fibroids are look like a pendulum. I hope you people remember the pendulum. So they are peducated. They are peducated, meaning they are attached by a narrow stalk. They are hanging by a narrow stalk outside the uterus. So, subserosal fibroid can develop as a single nodule or a cluster or group of growths. Subserosal fibroid can develop as a nodule or a cluster or a group of growths ranging from as small as 1 millimeter. So subserosal fibroid can develop as a single nodule or a cluster or group of growths ranging from as small as 1 millimeter or 0.04 inches to as large as 20 centimeters, into brackets 8 inches in diameter or more. This means this kind of a fibroid can grow extremely large. Uterine fibroids can grow as large as your head, your own head, or a watermelon. Let's discuss about the symptoms or how you can tell that a person is having subserosal fibroid. So in the symptoms, because of their location outside the uterus, subserosal fibroid is located outside the uterus. So because of their location, which is outside the uterus, they don't necessarily interfere with the uterine function. So you may have the subserosal fibroid, but all your uterine functions are intact. Note this: heavy menstrual bleeding is common to uterine fibroids, but it's less common with subserosal fibroid because it's outside the uterus, not inside the uterus. Symptoms are less common but include 1. Heaviness or fullness of bladder, lower abdominal pain or pelvis, frequent need to urinate, constipation or fullness of the abdomen. We have what we call bloating. We have abdominal pain and cramping. We have enlargement of lower abdomen. We have pain during sexual intercourse. We have lower back leg pain. We have inability to urinate or empty the bladder completely. Let's come to the next point, whereby we will see or discuss the causes of subserosal fibroid. The exact cause has never or has not been pinpointed, but risk factors to this kind of a fibroid include: 1, age. When it comes to age, for example, age 30 years through menopause can predispose one to getting the fibroids, and this is the childbearing age. We have positive family history of fibroids. If one of your parents or one of your family members has once had fibroids, this can predispose you to getting this kind of a disease. We have ethnicity. Here, black people are more prone to fibroids than white people. Number 4, we have hormones. Affected levels of hormones, e.g. progesterone and estrogen, can predispose one to having this kind of fibroid or subserosal fibroid. So note this: use of artificial hormone slows down fibroid growth. Use of artificial hormone slows down the growth of this kind of fibroid. I hope you get this. Use of artificial hormone slows down the rate at which the fibroid grows. Number 5, another risk factor to fibroid is the body size. For example, if you are obesity or overweight, you are at a greater risk of developing fibroids. Next point, we have diet. Diet with a lot of red meat increases the chances of developing subserosal fibroid. Next point, we have what we call childbirth. If you have never given birth, this can predispose you or can increase the risk of you developing subserosal fibroid. This marks the end of this video, or the end of the first video in subserosal fibroid. Let's meet in the next video, whereby we are going to discuss about the diagnosis and treatment of subserosal fibroid. Thank you for your time. Thank you for being with me. Thank you for your support. Let's continue subscribing, sharing, and commenting on our videos so that they may reach as many people as possible. Let's keep locked. Let's meet in the next video.